Well, I think the biggest thing, and I think this is true with a lot of women, they don't feel their age, but they're starting to look their age. And I have a positive outlook and I'm an optimistic person, but the way I felt I looked was sort of starting to drag me down. I mean, it was kind of weighing on me, and I thought, I don't look as good as I feel, and that's not a good thing. When I can do something, hopefully, to improve the way I feel about the way I look. Plastic surgery was my only option because at 70 years old, you can't just do, you can't do it with makeup anymore. And I was starting to, have the jowl look here. I had a double chin. My neck was starting to fall a little bit. So when I saw Dr. Clinton and he asked me what I wanted, I said, well, I'm not sure what I want, but this is what I want to get rid of. Well, I liked him from the minute I met him. I mean, he's businesslike, but yet he's casual. He's very open, very approachable, very friendly. But one of the best things about him is he's a good listener. And a lot of doctors are not good listeners. So I took the approach with him. I told him what I wasn't happy with, and I said, you're the expert, you tell me what I need, which is what he did. I feel like at my age, I'm a pretty good judge of character, and he comes across as very sincere, knows what he's talking about, kind of gets right to the point. I just felt comfortable with him, and I think that that's the most important thing. I mean, you can tell or you should be able to when you talk to somebody, if this is real. And I just liked him from the minute I met him. They had told, one of the surgical nurses, I had told her because I was having basically 2 procedures done at the same time, that I was concerned about the aftercare because it seemed like a lot and I was a little overwhelmed by it. And I remember she said to me, don't you worry about it. We are going to be here and we will hold your hand every step of the way. And that's exactly what they did. I mean, they're only a phone call away. But Dr. Clinton saw me frequently afterwards. And I have to say, because when I tell most people this, they do not believe me, I never had to take 1 pain pill after surgery, which shocked me. I didn't have any pain. After about 4 days, when sort of, my nerves in my face started tingling again, that sort of thing, I thought, well, I guess I'll take a Tylenol. And I took Tylenol for a couple of weeks, and that was all I ever had to take, which, as I said, that was great. I loved it. Well, it just makes you think you can live forever, and be happy with it. I mean, it's really, for me, kind of life-changing. I have a lot of experience because of my age in dealing with medical practices. And this is, without a doubt, the best run medical practice I have ever had experience with. And every single person here is dedicated to being sure that their patient is happy. If they need anything, they will see that they get it. They want you to have the best experience you can possibly have and the best result you can have. And if you do what they tell you to do and behave, you will have an outstanding result. So I would say if you're thinking about doing something, I really waited 10 years to have this done. I wish I had done it 10 years ago. But I would say you just have to go for it because you'll be happy.